We are today celebrating the opening, which we're all very excited about. It's the next chapter of Newmedica Bristol in our quest to be able to support the local community.
This is one of 4 centres that we now run in Bristol. It's the largest by far and has been christened the flagship of Newmedica.
We have a great facility here where we're able to run potentially 2 clinics side by side alongside a laser clinic on top and theatre going on at the same time. We're all based in the same location, our admin staff as well as the clinical staff, and we feel it's a really good location, easy to get to for patients.
This is a 7-day-a-week service. We offer a full service of ophthalmology with outpatients, which includes cataracts pre-op and post-op, glaucomas, including follow-ups and news, ocular plastics, YAG and SLT lasers, and some medical retinal.
We do most aspects of eye care. There are some things that we can't do here that need to be done in a hospital setting. General anaesthetics, for example, we can't offer that. But we cover, I would say, 90% of ophthalmology management and treatments.
We are here to provide an ophthalmology service for the community throughout Bristol and the South West. We provide an ophthalmology service which is both set up for a treatment in an efficient way, but also in a caring way.
We like to feel that patients leave us feeling they've had a really good experience. They haven't just been to see the doctor, they've been cared for as an individual, and they go away feeling better than when they came in.
We're very humbled to see some of the fantastic feedback we get. That just shows us that we are on the right track. Patients enjoy their journey.
I think people feel coming to a setup like this is less stressful, it's calmer, there's a large car park outside, so that's not an issue for them. So all the things that patients find stressful about going to a big hospital, I think they don't get here.
When our patients arrive at Newmedica Bristol, they're greeted by a member of our receptionist team. We have a really lovely, spacious waiting room so that we can run multiple clinics as well as theatre at any one time. When they arrive on site, this is the first room that a patient would come to. They have a number of clinical tests carried out by a member of our ophthalmic team, and that includes visual acuities, biometry measurements. We would then go through and see our optometrist, and in here they take a full history of the patient, undertake a slit lamp examination, dilate the pupils. They come into the 3rd room, and that is where they would have their consultant appointment. And then a discussion would take place with the patient about what the next steps are. Do they wish to go for surgery? What that looks like, and then we would get consent from the patient, and then they would be listed for surgery. We undertake 3 different types of laser procedure here. We undertake YAG capsulotomy, YAG PI, and also SLT laser. This room is designated for laser, and what that means is there's no refractive issues in here, no windows, no lights, so that the consultant can do your laser procedure. We're also really lucky that we have a designated treatment room. This room allows us to be able to treat patients in a minor op situation without the need for a major theatre, which can be off-putting for patients. This is how we go into our theatre suite. So patients are brought through into our admissions lounge. So patients take a seat here, we check all of their details, we give them a medical band so that we can check that they are who we think that they are. And this is where the patients start their dilation process out here in our pre-op room. We then come through to the theatre consultant room, and this is a really important room because this is where they meet their surgeon for the day. We have a really robust lens bank here at Newmedica Bristol, and then we come through into our theatre suite. This is a state-of-the-art facility with all brand new equipment. I love the TV on the wall because it means that actually the machinery projects what's going on inside the eye onto the screen. So part of the induction program that we do for all of our staff is that they come in and watch some cataract surgery so that they know what a patient experience is like. And patient experience is really, really important to us, whether it's admin right the way up to the surgeon. We want our patients to feel as comfortable and as at ease as they possibly can. Why? Because it actually makes the experience much better for them. And part of that experience as well, which is great why this room's so big actually, is that if a patient says, actually, I'm really, really nervous, somebody comes in and holds that patient's hand just to give them that reassurance that everything's okay, and just give them that extra level of support. They exit the theatre suite through this door here into our discharge lounge. We also go through all of the discharge information, the drug regime, and what they should do if they do have any concerns after they've had their surgery. All of that is detailed and given to them on a piece of paper so that they can take that home. We provide our patients with a 24-hour emergency contact line, which is managed by one of the managers and a clinical director at all times.
So we're really keen to foster close relationships with all our local optometrists. We recognise that we're two sides of the same coin.
I'm really lucky actually. I get to look after the referral engagement team. What they do is they go out and work with the hospital teams to build relationships with local optometrists. And that's a really two-way thing, because we want to understand what do local optometrists want from us, and we also want to make sure they've got all the literature, all the information, so they feel really confident about recommending Newmedica or having Newmedica as part of their choice conversation.
Part of the job that I really, really enjoy is being able to go out there and see our optometry colleagues. We go out and give them new updated leaflets, new updated literature. It just allows us to build that relationship with them. They know who we are, we know who they are. It allows that communication to be really, really great. And when they feel that they have a query, instead of not knowing who to go to, they go, oh, we'll call Newmedica Bristol and they'll be able to help us.
We also run regular CPD events, so we're hoping to run one every 6 weeks or so over the next year, looking at topics such as glaucoma, cataracts, ocular plastics, and we recently did one on OCT interpretation. So yeah, it's really important to us that we foster those close relationships with local optoms.